So diagnostic approach, what you need to do basically with this brachycephalics, you need to do an examination of the upper airways. You look at the pharynx and at the larynx. You tend to do some chest x-rays, looking for tracheal hyperplasia and see if there's any pneumonia. Some people now routinely would do CTs of the heads to check, to look at what's going on with the nasal passage. I don't do it. I don't do CTs as part of my investigation because it's not going to change what I'm going to do. Okay, so I don't really, well, I know there could be a problem with the nasopharyngeal area or the motuberous or the conchi, but I'm not going to do anything about it. So why spend another 800, 1,000 pounds on a CT that doesn't change what I'm going to be doing? So I don't do CT. Some other surgeons in the practice do it, but then say, okay, yeah, then what? Doesn't change anything. You spend another grand and doesn't change what you're going to do. So anyway, I don't do CT, but if my patient, I said, after a few months is still not doing well and I'm happy with what I've done and what I've done has worked well, then I may do a CT of the head to see what's going on more with that nasal passage. If there was signs of gastrointestinal problems, either severe, you may decide to do some investigation at the same time and do some endoscopy or some fluoroscopy or swallowing study. And then what I always tend to do, I do everything under one single anesthesia. So these patients are very delicate patients. So instead of doing an anesthesia to examine the patient and see what's going on, then waking them up, that they can be a bit tricky, the recovery, and then doing a surgery another different day. What I tend to do basically is I anesthetize the patient, do my pharyngeal, laryngeal examination, and I anesthetize them in the radiology room. So straight away I do my chest x-rays, and from radiology room, they go directly to theater. So I do everything under one single anesthesia. Of course, they already come to me maybe because they've already been diagnosed or you more or less know what's going on from the referring vet. But I will tell you, if you're going to do it, I will just do everything under one single anesthesia, and that way you get less complications from the recovery from anesthesia, and then you're ready to go.